Okay, I'm unable to hear you, Baba. I'll be happy if you can go to the chat room because I'll start the event officially now. So, hello everyone, and thank you for coming on board. Yes, we are putting down a list for 100 World Humanitarians to be recognized World Humanitarian Day coming up on the 19th of August, which is just less than 6 weeks from now. So I'm Princess Dr. Yewande Okunoren-Oyekenu for those that don't know me. And I'm the editor-in-chief. However, I do have a managing editor, Christina De Silva. She's also the celebrated humanitarian for this year because she's done so much. She's done so much in Europe, in the US, and other parts of the world. World Humanitarian Day is a day marked by the United Nations to remember humanitarians that have suffered. They suffered a lot of United Nations buildings are attacked. For me, I joined the United Nations in 2006. I joined as under UNICEF in my state of deployment back in Nigeria. I joined as a volunteer and I rose up to vice president in my state of deployment. Then I was just 24 years old, talking to people about HIV prevention. And that really gave me opportunity because volunteering is what I really love. What we are doing today is just to put together a few people. When I say a few people, I mean 100 people. There are so many humanitarians out there. If we look at South America, North America, Europe, Africa, Asia, and Middle East, as well as Australia. And we have people that you can't just talk about humanitarian because humanitarianism is a business, for some. You leave out their organization. You can't talk about World Humanitarians Day, for example, and not talk about United Nations because it's a day they have put down for humanitarians, both living and past, to be remembered. Last year, we couldn't have so much activity because we're just coming out of the pandemic. So we want to make sure people are healthy and safe. But this year, we want to have this 100 people as icons. We want them to be able to be a pillar in their community. Yes, they're already pillars in their community, but we want to give them more power by saying, yes, we are recognizing you for all that you do. And we will want to see more of what you do. We want to see youth in your environment. The good thing about it is that International Youth Day is August 12th and World Humanitarian Day is August 19th. So we always try to say the 40 on the 40s. For those that know about it, the under 40s, we give them the opportunity to advertise themselves on the 40 magazine. But the World Humanitarian, we like to focus on people who are at the peak of their career to say, yes, I've been a humanitarian for 50 years, or I've been a humanitarian for 5 years. So for us, age is, because we can't say, oh, maybe next year, you didn't make it this year, maybe next year, and the person is, is quite old. So we would not want to put them on a waiting list and say, okay, the younger ones can come to 40 on the 40 or other publications that we have. Christina De Silvio is not able to join us today. She's going to be available on Friday. So we are putting the list together and there's going to be a sorting, of course. We've decided that, of course, we want the best performers. We want to give the world what they deserve. And of course, we want quality in our publication as well. So we always ask that humanitarians support us with whatever they can. We did say $50, but we know that in some regions, in Africa and Asia, they may not be able to afford $50 per humanitarian. This goes towards our publishing cost as well, because, we do have a publisher. And of course, we have to package this and make sure it's available on Amazon. So we want it to be properly done. And that's where, the money goes. So we are volunteering. We are volunteering to say, yes, we are volunteers. we've done so well, and we want that day for recognition for people who are living, because yes, World Humanitarian Day is to remember those people who lost their lives in the United Nations building. But we want people who are living as well to be encouraged. If we don't want to remember people and throw parties for them when they die, no, that's not good enough. We should be able to celebrate legends while they are alive. So I'll give you the opportunity because you came first, Sir Mukhtar Baba. I hope I pronounced it right. To introduce yourself and tell us about your humanitarian cause and your region, because we are going to be grouping people by region. And then following you will be Hakon Mansient Uland. I'm sure you'll be able to introduce yourself properly. So, Sir Mukhtar Baba, please.
Hello.
Hello.
Good afternoon, everyone there.
Good afternoon, sir.
Yeah, I think you spell it well. Thank you, Doc. Mukhtar Baba, that's the name. I'm joining from Nigeria, Northwest, precisely Kano State.
Can you tell us a little bit about your humanitarian work? What have you done for mankind?
Okay, actually, I think I have a little issue in the beginning. I missed some of the earlier introductions. However, let me go straight to the question. I'm a development specialist for over 15 years for now. And I was one time opportune to work in private sector, public sector as well. My humanitarian is mostly around education, also water and sanitation, and woman empowerment. So this is where I personally, this is my own personal commitment, in addition to my own, I'm a development consultant, as I said earlier. So I do usually go to, from where I came from, let me say my primary school, annually, or like, yes, let me say annually, to contribute with writing materials and so on and so on, so that to encourage them, say this one of you that's is trying to say, okay, give back to community from the little that we were able to do. And then the women empowerment, I usually organize economy and farming, because my specialization is MSMEs development. And so how they can start, nurture, and develop their own businesses. Then also lately we facilitate with the family to facilitate drinking water in some localities, in some areas within my localities. So, and also the youth in youth development. So in terms of where I work, I usually work with youth, especially the vulnerable youth, marginalized youth, out of school girls, children. So, in summary.
Thank you very much, sir. We will all have opportunity. Of course, we're screening, and definitely I can tell you that we're trying to do first come, first serve as well. So
Okay.
for you to be in this meeting, we want to make sure that we're as brief as possible. So I'll let, I don't know how to pronounce your name, and I don't want to mispronounce.
Moksha.
Over
Please
to
call me
you.
Hawk.
Hawk,
Hawk,
okay.
like the bird. Yeah, it's much easier.
Okay.
I was called that when I was in the States back in 83, 84. Håkon is my actual name. I come from Norway. And I started working in social work in institutions back in 1983. Spent the first 10 years working with autism, all among some of the really challenging ones, wants to hurt themselves, hurt others, didn't have a language. I was blessed to have my mother, who was a psychologist, as my boss for the first 10 years. So I learned so much from her. I have, in all, I've spent 22 years working in social work. Also been working in child protective. I'm a child welfare worker, which is a specialized form of social worker here in Norway. I'm a healer. I'm licensed certified healer in Falun, which is Tibetan energy healing, in holistic healing and song healing. And I'm an artist. And I'm a monk. I've been a monk for 5 years, but haven't always been. So I have 3 children, beautiful children, and 1 granddaughter, Maya. She's 2 years old soon, and she's just wow, she is so amazing. It's just so cool to see her grow up. I am like Mukhtar. I'm very concerned when it comes to equality. We in Norway we have come a long way compared to many countries when it comes to equality for and not taking into account the color of your skin, your sex, anything like that. But there are still issues. So there are things that need to be fixed, and I think that's been a very important part of my mission as a monk, is to see people as people, to look beyond all of this, my pale face and all that. It's not really what matters. What matters is what lies within. That's also what I try to do with my music, to touch people. Yeah, and I have a beautiful dog. Nessie, come. Yeah. My little dog. Great.
Oh, great.
Yeah. She's an adoptee. She has been in 2 families before, and she is as tough as the Malinois can be. And she's perfect for me. So we travel everywhere together. When we're actually in Sweden now, I've been to a meeting, or I'm helping some parents who's in trouble with the authorities, because they take in custody, or they want to take custody of their children on the basis of very flawed arguments and not breaking a lot of laws and stuff. So that's part of what I do to help people who get problems with the system. Yeah, that's me.
Thank you very much, sir. So I've just put in the chat room now. I'm expecting your profile picture and summary. So the editorial team have a meeting on Friday. So of course, and then next week, Friday. So of course, we're having batches. So we can already see that in this meeting, we have somebody from Africa. We have somebody from Europe. I'm representing UK and North America region because I volunteer for the UK and North America region at International Human Rights Commission and other organizations I represent. So I've got 5 countries, the UK, Ireland, US, Canada, and Mexico these are 5 great countries, and for you to come out and say you want to represent those countries, you need to understand, the constitution and everything. And each of those countries, I must tell you, are different. Even though they're all English speaking, except Mexico, which is Spanish speaking, of course, English and Spanish. I know the challenges I face. I started as a volunteer, and I remember that I asked from headquarters that I want to volunteer, and I did get a link to apply and somebody to recommend me. And then there was the issue of I was so eager to start, and I was like, who's gonna be my boss? Who do I report to? I want to do so much. Who do I report to? And they're like, there's nobody to report to. So I know there must be somebody for me to report to. So when you come somewhere to volunteer and there's nobody to report to, and that's how I started. So I did a few volunteering work, and of course I had to be appointed as the regional volunteers coordinator for England and Wales, and then for the whole of UK. And I just got a call from head office one day and say, you know what, you're already doing England, Wales, Scotland, I don't know, why don't you just be the national coordinator for the UK? And then because I'm a member, soon to be a fellow of the American College of Healthcare Executives, and volunteering is very important on your journey to become a fellow. And then I said, look, I think I will be more useful if I add America and Canada, the whole of North America to my region. And of course, it was quite easy for me because the UK and US share information, the US and Canada share information, and these countries, UK and Ireland, except for Mexico. But when I started speaking Mexico, then the people from Brazil started disturbing me, who is our multinational coordinator. So at the end of the day, I found that I'm representing so many countries. And because I'm Black, people from Africa keep bothering me. And I'm like, I'm just your coordinator. And like, but it's not about being the coordinator. I want to be on your project. So one thing I want to leave as a takeaway is I'm using myself as an example. I started volunteering at the age of 10. There was a riot. It was a religious strike in the northern part of Nigeria. Muktababa would understand this. And we had people running into the compound because I schooled in a military school. So there was an opportunity for people to run into the military school for safety. Any military, even if it's a nursery school, any military compound is a safe zone. So that's why you see there's a background of military. So my dad was also in the army, and he's a prince. And I would never forget that day at the age of 10, I saw women running, and then you can imagine grade 10 and grade 11 girls betting babies. Babies were just falling out of women everywhere. Everywhere was in chaos. People were thinking, oh, I can't wait for us to just go home because they need to declare this an emergency and we all go home. And there was a lady that saw her parents running into my school compound for refuge, meaning that there's no home to go. The house has been burnt. So if they asked us to go home, she would stay in the school compound with her parents as refugees. I remember that I went back to Lagos. So I went back to the city with nothing but my backpack. I didn't wait to pack anything. I got on the plane and I was back home, and I told my parents, I'm not going back there. And then I schooled in the city. I came back with an accent. Obviously, I came back with a Hausa accent, and then I adjusted. When you're in the military, you go from one place to another. So that explains my strange accent for people that wonder where I'm from. Speak different accents whenever I go. So by the age of 10, I had lived in about 4 different parts of Nigeria because they keep posting my dad, and he retired as a captain. Seeing that volunteering at the age of 10 meant I took my clothes because I was quite small at the age of 10. So I had my clothes were able to fit the children that were running into the compound. So my boarding school uniforms, I just put everything, my undies, everything that could just clothe them. Before I even finish putting things together, their moms were already putting their hands on the line and taking my clothes and wearing for their children. You can't stop refugees from taking things. And I was like, don't worry, I'll bring more. you know, it's a period in my life I'll never forget, and that made me strong. People don't understand why I volunteer. Why are you volunteering? Nobody's, well, you should be paid. You should be paid. I'm like, just pray you don't face a disaster. So that's the beginning of my journey. I wouldn't say the end of my journey because I'm in my early 40s. So I wouldn't say I know that I've devoted my life to, volunteering. And then COVID happened. From Scotland, I moved to England. From England, I was putting my bags together. I was on my way to California, and then COVID happened.
Mm.
And then the Royal Voluntary Service called us. Oh, we have to join the Royal Voluntary Service. So before the Royal Voluntary Service called us, the British Pharmacological Society called us that, look, I know we are scientists. We don't want to go to hospital. What happens there don't concern us, but our colleagues are struggling. So based on that, I said, okay, if the British Pharmacological Society says we should, because scientists don't have problem with hospital if they're dying, ours is to maybe make vaccines, make drugs, give it to the nurses, go inject them, whatever you like, count us out. But this was a time where even movie stars were giving people vaccines. So I remember going to a vaccination center. I couldn't inject because I'm a scientist. If you ask me to draw blood, yeah, I will keep drawing till the bag is full. But to give somebody an injection, I'm not a nurse. So I just stayed on steward. I was on vaccination side, and I was speaking with people online. Some people were going to die. Like people were going to kill themselves. Just tell them to isolate. That's all. They didn't. They just said stay at home for 14 days. You see, there are some people that can't stay at home for 14 minutes. They must go out.
Mm.
Hope you understand what I'm saying. The elderly
Yeah.
people in Europe want to get on the bus first thing in the morning, have fun. They've got a bus pass, and you ask them to stay at home for 14 days. So as my skill as a neuroscientist came forward, I had to speak with them, to stay put. You are not going to die because if you go out, you could get something worse. Because then we had no idea what was going on. There was no vaccine, there was nothing. So for a whole year, there was nothing. And it was risky saying, I want to go into their house to see if they're okay. I have to call them and believe what they say. If they say they've eaten, they've eaten. I don't know. But for me, my doctorate is specialized in telemedicine. And this is when I started to push that, look, we should start using telephone and video apps. And, things are beginning to change. Things are beginning to change. So I'm grateful. I'm grateful that I survived the pandemic because at care homes, mental health units, I know a lot of people who died. When I call, oh, what's this person? Oh, he's no more. It was a mess, which we don't pray to go back to. So somebody like Mukhtar Baba, he's in Nigeria, and they may not really understand what COVID went, how we went through. But Hawk, you understand because European countries, North American countries were mostly affected. And the simple instruction was put on the mask. But because people have a right, it's a democratic, I have a right until bus drivers started. Don't put on your mask, you don't get on my bus. So I think the freedom affected, how COVID spread and, people could do whatever they wanted if they don't want to wear a mask. And a lot happened, but we thank God we're past it. COVID pandemic is not what I pray to see anymore. There are times now I'm on other activities because COVID has gone. I'm a COVID responder. Doesn't mean I'm now jobless. The system is putting us on other projects. It's okay. There are elderly people that can't get their prescription. Why don't you go to okay, start picking up prescription for people. So when you're a COVID responder or disaster preparedness responder, you are on standby. Standby means you can be called up at any time. And that's what I want to leave behind for as we prepare International Youth Day, World Humanitarian Day, and other United Nations holidays and days that have been commemorated. The reason is that people don't know why they are volunteering. They're probably volunteering because they need to satisfy something, maybe a community activity. But if you volunteer from your heart, you don't even need, because even if the British Pharmacology Society didn't call us, I would have stepped forward to stop the spread of COVID. So I don't want to take too much time, so I will just expect your profile picture and your humanitarian work. So I hope that my story has not scared some people, because some people might say, no, I just do mine in the community. It's not 5 countries, you know. So for the past 2 years, when I come and say, oh, I'm a volunteer today, and somebody says, you're now regional coordinator, I'm confused. Oh, you are now national, you are now multinational. Oh, now you're talking of ambassador, now you're talking of this. You know, when you volunteer with your heart, you don't need to ask for promotion. It just comes, you know. But some people are saying, oh, I'm only doing it for some time and that's it. Remember, there are people in the community that when you volunteer, if you stop, people in the community are going to suffer. And that's the reason why humanitarians are celebrated. They don't need a gift. They are not doing it for an award. They're doing it for the community. The community will definitely celebrate you. And even if they don't do it, that's why we're here. We're here to celebrate you. We're here to celebrate one another. I've told the team I don't want to be celebrated, but they're like, no, we want to hear your story. You are the leader. You know, you must tell us something, so we have something to follow as well. So this year we're celebrating Christina de Silvio as well. And you can see that in this meeting, we've covered about 7 countries. And because Hawk is talking of Norway, you know, we're already cutting across North America. Gloria is not here. She would have spoken for South America. So I wouldn't talk about the air ambulance project today. That's for another day. The actual induction is on the 14th of July. So for people who are in disaster preparedness in their region and maybe they know about emergency response, maybe road ambulance or air ambulance, yes, they are welcome to come on board. So I offer that as part of my UK and North America region to say, yes, let's build a plane. Yes, let's build this. Let's build a flying hospital, you know, where we can say there's a disaster. Oh, there's earthquake in Turkey. Okay, let's fly there when the patients are well. We'll fly to another place. We need to break a lot of cross-country barriers. And that's the pride for humanitarians. Humanitarians can get on a plane and go anywhere. They can. They're ready, you know, to travel anywhere. So that's one tip for being a good humanitarian. Don't say, "Oh, but I'm in Europe and I don't know anything. I can't speak South American languages." They have translators. I have my book written in 17 languages, and I am going to celebrate all my translators. It took about 35 to 40 translators to put that project together. And I had to say, stop, please, that's enough. But more people are coming to say, it's a medical book in, you know, in French, in Spanish, in Brazilian Portuguese, you know, in Italian language. And people were like, wow, medical books written in Hindi, medical books written in Hausa. So Mukta Baba, yes, your language is there. Hawk, what languages do you speak?
I speak Norwegian, Swedish, Danish, German.
Yes,
a
we
little
have
bit
German.
French.
Yes, we have
a little bit-
German.
Yes,
We have German.
and I'm learning Latin now, but that's not a living language, so I'm not sure if that's very usable. That's more to understand the roots of languages.
Yes.
Yeah, that's about it. Yeah, a little bit of Portuguese.
Yes.
And a little bit Spanish.
Yes, I've learned that from volunteering. Languages and language translators, they go hand in hand. If you can speak a language, fine. If you can speak more, better for you, is an added advantage. So we have English, we have Bengali, we have Hindi, we have Turkish, we have Brazilian Portuguese, we have Chinese, yes, we have Filipino, we have Yoruba, Igbo, Hausa, we have Chichewa, we have Idoma. Which one have I left out now? So Brazilian, Portuguese, English, Spanish, Italian, German,
Zulu?
French. Yeah. So we've got all those languages, and my translators are like, Dr. Yewande, when is the project starting? I want to, these translators are ready. I want to start, and then I was like, you are under disaster preparedness. So
Mm.
you are happy to translate. I'm not happy for a disaster to happen, but they are there on standby anytime we need them. So I'm grateful to my translators, with whom, without them, I couldn't have done this much, and I am grateful. So please, I look out for if you're not able to send an email, just send me a message on LinkedIn, 100 World Humanitarians. So you can see in this meeting, we've seen only myself, but I've got 17 translated books, which covers, so we want to celebrate maybe the best translators and say, okay, let's give 10 translators an award. Not just, some people just pick a book and just translate it and there it is. But some people went with their heart, to go and search for the meaning of those medical terminologies and give it a perfect translation. And I think these are the kind of people United Nations should be hiring. That's my recommendation. That's my recommendation.
Yeah.
So thank you.
I see the value of good translators. I used to work with refugees,
Yes.
so I had to pick up some Pashto and Dari, and sometimes I sat in meetings with the boys I worked with and young single immigrants, and I was like, "Excuse me, you didn't say that." Oh yes, he did. No, he did not, because I did know some of the words, so I was able to make sure that we had a good understanding. It's so important when you work with people to truly, because there are such small nuances that can get lost in translation. So see what you're talking about.
Thank you so much, everyone. And on this journey with me, there will be 100 of us. Of course, you can see the picture of Christina on the cover. She's under Europe, but she's got one leg in Europe, one leg in the US, So you can see in this meeting my humble self. You can see Hawk. You can see Muktaba from Africa. So we've got, major places covered. Gloria is not here, as I said, she's from South America. And they've really been bothering me, let's start. So hopefully you'll be hearing more from me and seeing more messages via email or via LinkedIn, so that we can get the best pictures of you and your work. And if you have a company logo that you want to promote, great. So we just say whatever you want to use to support. It would be great. And I've done all this, majority of it self-funded. And that's why I'm saying whatever you want to support, because I'm an author. So I can write and just put things out there. But when we're putting different people from different regions together, I think it's necessary for us to make it known that, yes, support is acceptable if you want to support. So that being said, my French is bad, but over.
Thank you very much.
Bye.
Nice meeting you. Bye.
Nagudi.
Nagode.
Bye.
Yeah. Thank you.
Okay.